everybody. Welcome to Variety Talk live from Las Vegas. I am your host, Lady Linda. Welcome to the show, or Linda Leak, whatever you want to call me. Just call me. But actually, we have something very serious today that we're speaking about, and that is pain. I don't know who you are or where you are or what sort of circumstances you may have been confronted with within your life. But all of us have experienced some sort of trauma to the body, mind, and spirit. And so today we will be talking about alternatives to pain management. And so I have done a wonderful thing, which was to have a great afternoon with the Dr. Robert H. Odell Jr., MD, PhD, and he is with the Neuropathy and Pain Centers of America. And Dr. Odell is just one of the most experienced physicians in pain management, and it was very exciting to watch him and to speak to some of his clients who are patients who have actually come in with a great deal of trauma and pain to their feet, their hands, different parts of their body, but mostly we're speaking about neuropathy and how the end result was almost painless. So basically this is non-invasive, non-surgical, non-pharmacological. This doctor is amazing. He actually has a new system that for which he treats his patients. So without further ado, let's go and visit Dr. Odell. Hi everyone, welcome to Variety Talk. I am your host, Linda Leak, and we're here today in wonderful Las Vegas at the Neuropathy Pain Centers of America. We're here with Dr. Robert Odell, MD, who has a very unique treatment for pain. So I'm sure that all of you at one point or the other have experienced some sort of pain. Well, this is the place to be. We'll show you why. Let's go inside.
Being born and raised in Las Vegas, I've had many people ask me, geez, do you guys have churches and grocery stores? And I'm like, yeah, and we've got doctors too, really good doctors. About 5 months ago, I had zero feeling in my feet and my legs, and now I have about a 60% return. Some people may have a different outcome, but for me, he has done wonders.
Neuropathy and Pain Centers of Las Vegas. The future is now. Short-term treatments and long-term results.
Hi everybody, welcome back to the show. We're sitting in again at the Neuropathy and Pain Centers of America with Dr. Odell, who has a very unique way of treating patients with pain. So doctor, before we actually get into all the specifics of what and how you treat your patients, let's find out a little bit about you.
Well, I trained undergrad at the University of Pennsylvania and then went out to Stanford Medical School in 1970. I can remember driving out there in my 1967 Cutlass to the tunes of Green-Eyed Lady, which was popular then. That was, a lot of you probably weren't born at that time. Anyway, so I went to Stanford, did a 6-year program, MD PhD with a PhD in bioengineering, and then went ahead and did an internship, and then did my anesthesia residency at UCLA in Southern California, mostly a little county. I began practicing private practice for anesthesia, and in 1994 I actually moved here to Las Vegas. About 3 or 4 years later, I started thinking about doing pain medicine. When I was a resident, there were no fellowships in pain medicine, but pain medicine was just becoming popular. The reason I gravitated toward that is because I really like to do regional anesthesia. We can do a lot of things for people using spinals, epidurals, arm blocks, things like that, where you don't have to put the patient to sleep. A lot of anesthesiologists just put the patient to sleep because it's the easiest. And a lot of studies show that taking the time and the effort to do the regional anesthesia is better for them. And it's a superior way. For example, if you have anesthesia below the waist, a bladder surgery or something, you don't have to go to sleep. You have a little sedation and you're alert the whole day. I had a spinal for my knee scope, and I was here in the office, 4 hours later, doing fine. So I started taking the courses, the weekend courses. I really couldn't afford to take the time off for a fellowship, as was becoming popular at that time. And I trained with ISIS, not the terrorists, but the International Spine Intervention Society, which was actually the first group with widespread quality weekend courses or week-long courses where they built upon our abilities and our knowledge of anatomy and our knowledge of the regional anesthesia to start doing the fancier blocks. There's a lot more to pain management than just doing the blocks. And I started doing this in 2001, and now it's 2018.
And when you're saying blocks, meaning
injections.
Okay.
Injections,
All
yeah. And again, I did some work in Arizona. I came up, I opened up in this location in about 2008 with a podiatrist, and then I moved next door, was on my own for the few more years, and then moved back here.
Well, what's so exciting about this whole part is the fact that, I've never ever seen such a situation before, and I can't wait to get into the room and let everyone see the machines that you have, the treatment that you have. So that's what's really exciting to me, is to find out exactly, by way of what you're speaking of, your background and how you got into pain management as an anesthesiologist and learning about pain and how to treat pain. That was the intro. And so since then, you've moved here, as you said, and now you're getting in patients who are complaining about what? What are the major things that they're...
Well, we do back pain, neck pain. We don't help with your spouse, those kind of pains, just spine pain, arm pain. We also, I had the good fortune to meet Dr. Richard Sonyard in 2003. He has been developing one of the most advanced electromedical devices in the planet. And what this device can do, it actually can reverse neuropathic pain and treat somatic pain.
Wow.
With energy techniques. And this really is one of the waves of the future. When you're my age, a lot of it will be gene therapy and treatment with energy methods.
Okay.
For example, I began working with chiropractors doing vertebral axial decompression, which is stretching the back. Mm-hmm. That's a non-surgical way of getting rid of spine pain due to the discs. And Medicare in 1997 passed a national coverage decision and quashed it, but people are being forced to pay cash. But they really, in my opinion, did a disservice, because a lot of people have been operated on their backs, and there are people I have to take care of now with chronic pain, because mm-hmm. Their status post back surgery, either fusions or just laminectomies, and it's a very difficult problem. So as we developed, we finally figured out that Dr. Sonyard and I, through some work with some others in Atlanta earlier in the 2000s, that if we started adding injections to the machine, we could treat pain from a variety of places. We finally realized that a great unmet need was neuropathic pain, especially distal, which means near the feet, symmetric, which means roughly equal, that is not coming from the back, neuropathy. Neuropathy means pain is the nerve is the problem. Now, if I pinch myself here, I feel some pain. Mm-hmm. Well, that is the nerve doing its job. Okay, so the nerve is the problem, and that's our first name, neuropathy. Pain centers is our second name.
Makes sense.
So what we do is we use a combination of this electromedical device and local anesthetic injections, and we can actually improve the lives of 80% of our patients.
Wow.
And basically, unlike with Lyrica and gabapentin, the risk is zero. There's virtually no risk unless we drop the machine on their foot.
So what we're talking is, when you're saying, unlike Lyrica, that's medications. This is non-invasive, non-surgical, non-pharmacological. This is a situation where your patients can come in and have their pain treated without all of those things.
Not only that, if you look at a pie diagram of people who have neuropathy, let's take diabetic neuropathy, only 27% have positive symptoms, pain. The other people either have numbness or they don't know they have it. And we can treat people who come in with numbness only. That's a little more difficult than pain, but a variety of people with neuropathy don't even know they have it. Sometimes they get zingers or dysesthesias with shooting shocks.
Really?
And those are one of the first things to improve. What this device does, through a variety of mechanisms that I can go into, and they're kind of nerdy, but what they do is it boosts the circulation, it increases the blood flow, same thing, it boosts the immune system. We use this for its anti-inflammatory effect. And if you take steroids, for example, for the anti-inflammatory effect, you're suppressing the immune system. It shakes the cells so fast that it increases the chances of the molecules reacting. Now, the inventor of the device, Dr. Sonyard, is a PhD in molecular biology. Dr. Robert Milne is our medical guy who comes up with all the formulations of the supplements people take. I'm just a needle jockey and gas passer here. but the combination of this electromedical device, by the way, it also blocks pain 4 different ways. 4 different ways.
Oh, that's major important.
When the nerves, not to get too nerdy, but when the nerves fire, there's something called an action potential. Mm-hmm. After the nerve fires, it has an absolute refractory period, which means it can't fire for a short period of time, milliseconds. Mm-hmm. Well, if we stimulate the cell, the nerve cell at 2,000 hertz, 2,000 cycles per second, what's going to happen is we're in the absolute refractory period, and that nerve is silent. Just like giving local anesthetic, where by a different mechanism that completely blocks the nerve, this does too. But with the nerve blocked open, if you can imagine, the nerve is open, it's not clamped down. If those of you that know the physiology of nerve transmission, this nerve is functioning and it can heal.
Okay.
And what this thing does, this device does, is it heals the nerves.
Wow.
Most people that I see are my age. I'm 71, maybe 55 to 85 or something. Sure, we can't heal as well as a 20-year-old can. Right. But so what? If we didn't heal, we wouldn't be alive.
Right.
Every one of us gets things and we heal. You cut yourself, it heals. And we are unleashing the power of the body to heal. Now, Lyrica, Neurontin, those are only treat the positive symptoms, the pain. And there's as much as a 60% profile. Mm. When I see those ads for diabetic nerve pain, honestly, I want to cringe. I really want to cringe. Unfortunately, the word on what we do is not out because we don't have the money that Pfizer does.
So what you're saying then is that this is not a Band-Aid. This doesn't just reduce the pain. This is an actual answer for healing.
It is, and not only that is I've shown with a neurosurgeon, Dr. Peter Carney, that we can actually regrow nerves. We've done epidermal nerve fiber density biopsies, which is a standard of care for the diagnosis of neuropathy, and you can actually see somebody with no nerve growth, and after treatment, the nerves have regrown. That may be a mechanism how people with numbness regain some of their feeling.
Oh my gosh! Okay, you know what? We're gonna stop you right there because this is so exciting, and we might as well go right into your next exam room and get an opportunity to meet one of the patients that you've been treating for a while that has actually a great story about the before and after picture of his pain.
Excellent.
So we'll be back in just a minute. You're watching Variety Talk live from Las Vegas. I'm your host, Linda Leak, and we're in with Dr. Robert Odell.
About 5 months ago, I had zero feeling in my feet and my legs, and now I have about a 60% return.
The work he does and the way the program works, if you work the program, you can be pain-free, and that is a miracle.
Some people may have a different outcome, but for me, he has done wonders.
Neuropathy and Pain Centers of Las Vegas. The future is now. Short-term treatments and long-term results.
Call today and get back to enjoying life.
We're here today with Mr. Alex Lopez, and Alex has actually served in the Army, and he has experienced trauma with his feet as a result of frostbite. So Alex, first of all, welcome to the show. Happy to have you on board with us.
Thank you.
I love your hat. World War II veteran. How about that? So tell us a little bit about your time in the service.
Oh, I was a machine gunner going through attacks and all that sort of stuff, and that was it.
Okay.
Just a machine gunner.
Well, not just. I tell you, it's very important what all of you have done to protect this country.
Thank you.
And so you wouldn't be sitting here unless you have experienced some sort of pain that brought you into this office. So I understand. Tell us about your story with the frostbite on your feet.
I carried the frostbite pain in bottle number 4 for 74 years, and my son contacted the doctor. He told me to come in here. So if you people got pain, see him. Yeah. Otherwise, forget it.
Okay.
Carry your pain.
And so we love that you love Dr. Odell, because that's a telltale sign that he knows what he's doing.
Yeah, but he won't go home with me.
Oh, well, I think think he's got his own family happening. But Alex, tell us a little bit about we're going to speak to Dr. O'Dell in just a minute about a demonstration in terms of how he's treating you. But what was it like when you first came in? What was that pain like?
It was a pain of number 4 at least for 74 years, night and day.
All right. And so you had numbness on your feet actually and that sort of thing as well?
Yes.
All right.
I had pain. Oh, yeah.
All right.
I worked 32 years with the pain and I got used to it. So then everything's good. So I came to see the doc and he's taking care of me.
So what's it like now? How do you feel?
I took my shoes off the other day and I walked on the carpet and I could feel the carpet.
Well, you know what? That's major right there because going from frostbite and numbness and then being able to actually have feeling in your feet is pretty tremendous. I understand you're a swing dancer.
Yep.
And I'll bet you couldn't do any swing dancing before coming to Dr. O'Dell.
Actually, I didn't even try, but I'm going to try Sunday.
All right. Well, you know what? That is the major, major part of our story right there. The fact that you can now swing dance, the fact that you can feel the carpet underneath your feet, and you had all of this as a trauma to your feet while you were in the service. So I'm so happy to hear that you're better. And so tell us about your experience with Dr. O'Dell and why you love him so much.
Well, you know, nobody has ever helped him in a whole life, and this man's come up and done a wonderful thing for me.
Tell us about that.
He's brought my pain down to number 2, and everybody says he couldn't do it, and he did it.
And so you've been to other physicians that have actually, and specialists, who have told you that you may not be able to recover at the rate for which you have recovered.
Yes, I have. I've been to doctors, and I can't say who it was because I might get into trouble.
No problem, but we're so happy to know that out of all of the doctors that have treated you, you actually found someone that could help you, and that's what the important part of it is.
Well, my son made me come to see him, and I didn't want to do it, but I'm so happy to see him. I said, hey, he's a nice guy.
All right, well, very good.
And all his people are nice people.
All right. Well, thanks for sharing with us today, Alex. We appreciate that so much.
I'm very happy.
And I'm gonna show up at the swing dancing right after you have your last treatment with Dr. O'Dell. You said next week, right? You going swing dancing?
Sunday.
All right. I'll be showing up to see how those feet are working.
I don't know. If she shows up, I'll be dancing. But she's been gone for 2 weeks, so I don't know if she's going to be there Sunday.
Well, we'll see what happens. Everybody who watches
that, huh?
Yeah, I saw it. You're watching Variety Talk live from Las Vegas. We're still here at the wonderful pain treatment centers, and we'll be back in just a minute.
When I met Dr. O'Dell about 10 months ago, I was highly addicted to an opioid called hydrocodone, and they were giving me the same amount they would give a 600-pound man. So I got off of the drugs within the first 6 months I was there. I am now walking and swimming and have quality of my life back, and he saved my life.
Neuropathy and Pain Centers of Las Vegas. The future is now. Short-term treatments and long-term results.
Call today and get back to enjoying life.
Hi, everybody. Welcome back to the show. And we're actually here now. In my opinion, the most important part of this is actually finding out about this new non-invasive, innovative treatment for pain. And we have Alex here with Dr. O'Dell, who will do a demonstration about how he is treating Alex. Dr. O'Dell.
Thank you. We're here in our main treatment area at the Neuropathy and Pain Centers of America, where we have 5 or 6 chairs where all the patients are treated for their neuropathy. What's nice about this is the patients who are just starting can hear from the patients who are finishing or in their treatment how well they're doing. As I may not have mentioned in the other room, this is a chronic disease, and treatment is required 3 times a week for several months. Western medicine is not good at treating chronic disease, except with pills. And don't get me wrong, for blood pressure, for psychotics, for antibiotics, for infections, pills are very, very important and have changed the way we live and increased our life. But for chronic disease, pain medication is not the answer. Healing is. In this region, in this area right here, we treat our neuropathy patients, that most of whom have distal symmetric neuropathy, which means it's probably not coming from the back. It's, roughly equal, and it's distal, meaning it's in the feet. They also may have neuropathy in their hands, which we also can treat simultaneously. I'm going to demonstrate the hookup with Alex and show you. These are vasopulse electrodes. Vasopulse electrodes work by the Venturi effect, and they actually will suction the skin. I'm not turning them on because of the noise it makes, but they will suction to the skin. And what this electrode does is it increases blood flow, reduces the resistance to electricity, and effectively, after a couple minutes, the electrode area is double. So it really is the most efficient way for getting electricity into the body. We can also use pads and other such electrodes, but the placement of the electrodes is actually what we call the montage, M-O-N-T-A-G-E, and then we program the device with different programs depending on where they are in their treatment. Now, in this case, because I don't have the suction, I'm just going to go ahead and show you the location, and this is what my technicians usually do while I'm being a doctor. But I've been doing this for so long, I could probably do it in my sleep. So here we wrap his foot, and then of course with the suction, we will go ahead and turn it on after the other ones are on. These electrodes can go one of several places. Not to be too nerdy, but if somebody has real distal disease way down here, we can put the electrodes here. But in general, we put them here over this is called the gastrocnemius muscle, the big muscle back here. And the reason we do that is because of the blood flow. As all of you probably know, blood flow is associated with healing. And we're talking about blood flow on a microcirculation level, down to where there's single red cells going through very tiny vessels, which has been shown to improve. Once we do that, and Alex, I think I'll ask you just to hold this with your hand because we don't have the vasopulse. And then these are like this. Then we go ahead and we turn on the device, and we can do any one of 16 programs. These programs for diabetic neuropathic patients is different than non-diabetic neuropathic patients, and we have a sequence of programs that go through 14 or 16 weeks, and then we start over. And I'll give you an example. This is called specific parameter electroanalgesia. I'll give you a simple example. The diabetic patients have some muscle stimulation programs in there, and we've had patients with foot drop, which is the nerve that's right here. If it's not working, you can't lift your foot up. That's called foot drop. We've actually reversed that in patients using the muscle stim programs. The diabetics need to have their muscles stimulated because, as you know, the more diabetics exercise, the less insulin resistance they have, and it's just better for their health. Any diabetic who exercises is going to be much healthier than somebody who does not, even the weight aside. Now, what the program does is it helps with the circulation and everything else, but it also does what you call sofa jogging, and it makes the muscles move and metabolize. Now, people who don't have diabetes, they have the neuropathy from, say, a toxin, chemotherapy, idiopathic is unknown. Those patients probably do not need that as much, and that's just a small example of how we utilize the differences in the programs here in order to optimize a patient's recovery. The specific parameter is important because, for example, certain nerves will react to different frequencies, and if we can find the frequency that nerve likes, that nerve is resonant to. The name of our company is Resonance Specific Technologies. What happens is, those of you probably that are my age will remember Galloping Gertie. That's a bridge in Washington State where the wind was the same frequency as the bridge. So the bridge started to move. It picked up the frequency and energy and broke apart. In this case, what happens is the frequencies, as the frequencies change, we use frequency modulation because that's actually the way the body works. If the frequency changes, and let's say it's right on the frequency that the nerve likes for 2 milliseconds, the nerve mitochondria, which is the energy source for the nerve cell, will take up that energy and it'll use it over time to heal. And again, this is a sequential process. I want to tell you a story that I tell almost every patient so that they know this is not a one and done. I had a patient who had neuropathy in his hands and his feet, and usually the hand neuropathy gets better without any additional treatment like injections that we have to do in the legs often. The reason is because the nerves are shorter. It hasn't had the disease as long. These nerves are not as long as these nerves. So this gentleman had neuropathy in his feet went away, but for some reason it didn't go away in his hands. So finally it went away in one of the hands, but the other hand, I went ahead and did blocks on the median nerve here, the ulnar nerve, and the sensory branch of the radial nerve. And I put the machine on after that on a Monday. Wednesday and Friday we did the machine. The following week we did the same thing, the block with the machine, and then 2 electroanalgesia machine treatments Wednesday and Friday. The next Monday I asked him, how you doing? It's a little better. Not that much maybe though. Okay, let's do the machine for 1 more week. The following Monday his pain was gone. Now, the reason for that is healing is nonlinear, and every treatment stacks on the other treatment. And the patients who come in who really don't want to come every other day, I kind of discourage them from coming because we want the resources used, whether it's the patients or the insurance or whoever, to be used to good stead. We want people who really want to be healed. We eventually hope to open up in other parts of this town so the neuropathy patients don't have to travel as far, and especially for the vets, because we do understand that it's a real burden. And we had other locations, but we've had a terrible time with Medicare giving us a hard time, and we're actually in court about that right now and doing very well. And I don't want to say any more about that, but it's been a real pleasure taking care of these patients, especially the vets, because you hear things like, I can feel the floor for the first time. One lady told me that she could walk around Red Square when she went with her husband to Moscow. One patient, morbidly obese, 49 years old, this guy walked for 2 hours a day after I treated him. He walked for 2 hours a day, and if you do the math, he was losing 20 pounds a month. And here's the neat thing. I helped him, but then he helped himself. The patients who help themselves far and away do the best.
Being born and raised in Las Vegas, I've had many people ask me, geez, do you guys have churches and grocery stores? And I'm like, yeah, and we've got doctors too, really good doctors. About 5 months ago, I had 0 feeling in my feet and my legs, and now I have about a 60% return. Some people may have a different outcome, but for me, he has done wonders.
Neuropathy and Pain Centers of Las Vegas. The future is now. Short-term treatments and long-term results.
Hey everybody, we're back and we're sitting in with another veteran who is also a patient of Dr. Odell here, and Kenny Brown. Kenny, hi, welcome to the show.
Hi.
It's so interesting to know, and really just a great privilege and honor to know Dr. Odell, who has worked with so many veterans, and I'm just excited to see all of the changes and all of the healing that has taken place by way of his innovative machine there. So first of all, why don't you just tell us a little bit about your story in terms of who you are as a veteran and what you did and how you served in the military.
Well, basically, I did junk patrols in amphibious boats for 2 tours, and then I was on a ship, the Leonard F. Mason, that gave gun support in Vietnam. When I was over there, I got Agent Orange contamination, and that it brought about the neuropathy from diabetes from it.
Wow.
And I actually brought my sister here for Dr. Odell because she has had total spine fusion and pain for about 50 years. And I heard him on Wayne Allen Root explain the process and the procedures that he uses. And she came and lived with me for 2 months to get treated, and she's totally pain-free for the first time.
Oh my goodness.
Since she was 10 years old.
Oh, since she was 10 years old.
Yeah.
Oh my goodness. Do you mind telling how old she is now?
She wouldn't want me to.
Well, that's okay. But
she's 67.
Wow.
And she had spine surgeries. She had idioscoliosis, which is curvature of the spine.
Yes. So, that is amazing. What a testimony.
Is, yeah.
Okay, so tell us a little bit, Kenny, about your time as a patient here. What was it like? What was the pain like when you first walked in the door?
Well, I had total numbness in my feet because of the diabetic, caused the neuropathy, and I've since went on insulin. And when I brought my sister here, I started getting the treatment from Dr. Odell, and 80% of it's gone.
Oh my goodness.
After only 6 months.
6 months?
Yeah.
Oh, that's amazing.
It is amazing.
That is amazing.
You think it's amazing to me.
Have you gone to other places before to try to get treatment?
Well, the VA, all they want to do is mask the symptoms, with opioids, and which, of course, is the worst thing you can do. It's not curing anything. It's just covering up the pain, right?
Yeah.
And ruining your liver and who knows what else.
Absolutely, absolutely. But that's what's so great about this invasive, and non-pharmacological treatment. It's just really great. So, well, I'll tell you, we're just pleased as punch to hear about this story, because I have now become an advocate of Dr. Odell just from listening to all of the patients tell their stories. So what advice do you have for anybody that's needs to visit this office, or that is experiencing pain like you're experiencing it with diabetes or in any way? What advice do you have for them?
Just call Dr. Odell, and then you come in for the evaluation, and he has multiple treatments that he gives, not just for the neuropathy, but also for, like with my sister, he actually did removing the nerves or ending the nerve endings, right?
Wow.
So I don't know about it medically what it is, but it's a miracle to us and the whole family.
Oh, that's wonderful. And by the way, before we go, we'd like to find out, because we also know that you have your own website that's established for the veterans. And tell us the name of it. warriorsassist.org or .com. And you're actually just getting information out there to the veterans and letting them know about anything medical and insurance benefits and things like that, and where to go and how to go about their business with as a veteran.
Well, it has direct links to all the state benefits, which a lot of veterans don't understand that they have, right? Like free fishing licenses, things like that. It's user friendly for old people like me. My daughter was a webmaster, and she did it for me for a birthday present.
Oh, that's awesome.
And so
tell us quickly then, on your website, do you have information as to how veterans can get insurance so that they can come here and see Dr. Odell?
The CHOICE program, which has been enhanced by the latest administration, was created in 2014. But you have to have the CHOICE program, be signed up with it, and have a card. The number is 866-606-8198, and they'll send you out the card, and that with your primary care provider, you go to the specialty and get the referral for the CHOICE program to come to Dr. Odell or any other outside provider.
Wonderful, wonderful, wonderful. And so, Variety Talk family, just want to make sure I let everybody know to support this gentleman who's doing a wonderful thing with his website, warriorsassist.org, okay? Make sure you check him out, support him, and we will be right back.
About 5 months ago, I had zero feeling in my feet and my legs, and now I have about a 60% return.
The work he does and the way the program works, if you work the program, you can be pain-free, and that is a miracle.
Some people may have a different outcome, but for me, he has done wonders.
Neuropathy and Pain Centers of Las Vegas. The future is now. Short-term treatments and long-term results.
Call today and get back to enjoying life.
Hi everyone, we're back, and we are actually sitting in with someone that you have got to know, because this is the lady that actually just ties everything together as well in regards to pain management and veterans, especially since we're on that topic today with Dr. Odell. This is Sue Phelps. Sue Phelps is actually a publisher with the Veterans Reporter News, as well as a member and president of the SMW, which is the Society of Military Widows, Chapter 34. So without further ado, Sue, welcome to the show.
Thank you so much.
Yeah, so happy to have you. All these titles and responsibilities, oh my goodness, you're busy. First of all, you're very busy. Yeah, so tell us a little bit about yourself.
Yes, I am busy. People, all the veteran community, people tell me, say, I see you everywhere. Because whenever I have an event, they call me, I go. And I report the event, and I tape the interview and bring back to my office, and my staff in my office put it together. So you see a lot of articles have me and my staff, Cherry Fisher's name there quite often. But how do I come to the Veteran Reporter News? I am the widow of veterans. My husband, Mr. Eugene Phelps, died of Agent Orange, 1981. He is at that time he had lung cancer. From the day diagnosis, he had lung cancer to the day he dies, only 10 months. And at that time,
And that's as a result of Agent Orange.
because he was in Vietnam.
Yes. Okay.
And that lung cancer it is, and he's
Okay.
working under those Agent Orange powders surrounding.
Yes. Yes.
So, and at that time in 1980s, there's not that many organizations know anything about Agent Orange. We was don't understand how come a healthy person like him all at once diagnosed with lung cancer. And I was very young. As a matter of fact, I was only 29. Okay, and he had to teach me everything. He teach me how to take care of him, in bond and everything, of service, and also teach me to tell who to call, for his funeral service, And so I learned that. But at that time, there's no organization in Las Vegas, in town, except the Nellis Air Force Base that I can reach. Say, my husband passed away, I need a military.
And at that time, Dr. Odell was not around where he could treat him or do anything to help.
Yeah.
That's unfortunate. But go right ahead.
Anyway, the veterans, when I come to Veteran Reporter News, which is from 2013 on, I take over from the previous owner, Chuck Baker. I realized the community, this whole community, have so many to offer. Okay, now to the people that need it. Unlike in the 80s, early 80s, So there's a lot of organizations, veterans organizations, and then all the veterans, and then also all the communities. We all come together to help. And the Veteran Reporter News has become very involved with every organizations. We have become the stage for all the veteran organizations.
Wonderful.
And also the mirror for the veteran organization. They can see each other from my paper. Okay, and I come around to be involved with the 675,000 veterans community. That I'm constantly being with. I find out something is a lot of those veterans are in their 60s, 70s, 80s. Okay, they are really face a lot. One time or another, they're facing a lot of pain, chronic pains, and they have told me, I live with my pain from the day I wake up till I go sleep. Those are their 70s.
Wow.
And then ladies in the Society of Military Widow, we will have a national convention last time, and our local ladies too. They all having pain one time, one place or another, because we're getting older, And they all say we're sick and tired of taking pills. Okay, and then when I find out Dr. Odell treatment is not taking oily pill as a treatment specifically to the point where the problem is. So that is a very, very good blasting information, blasting news, blasting opportunity for all my readers.
Absolutely.
That they can come to have this kind of treatment without further damage their body. Yeah.
Oh, that's really a big deal and very exciting to be able to share that. How many people do you reach with your paper?
My readership, this paper is known by the whole veteran community, which is 675,000
Wow.
veteran community
That's
in
impressive.
the southern Nevada area.
That's
Okay.
impressive. So,
And then my paper, we twice a month, 1st and 15th.
so
Print. Yeah.
1st and 15th is, and where can they find your paper?
All the VA hospital, VA clinic, libraries, and like VFW, American Legions
Okay, wonderful.
office, and then the Latinx Club in the Chinatown area.
Okay.
Yeah.
All right. So, Variety Talk veterans, make sure you take a look. Just look around out there for the Veterans Reporter News, and our friend Sue will keep you posted about Dr. Odell and all of the treatments that he will be giving and all the new things that are coming up with his treatments. And everybody, just make sure you stay in touch with the Veterans Reporter News, okay? All right, we're going to take Sue, thanks for joining us. Sue Phelps, everyone, in case you like to give her some information to share with the other veterans. All right, and we're going to go ahead and close out this segment. Thanks for sharing your information and your experience with pain and pain management. And especially as it relates to this office with Dr. Odell. All right,
Thank you.
Happy to have you on board. We're going to take another quick station break, and when we come back, we're going to close with Dr. Odell. I am Linda Leake, your host, and you're watching Variety Talk live from Las Vegas.
When I met Dr. Odell about 10 months ago, I was highly addicted to an opioid called hydrocodone, and they were giving me the same amount they would give a 600-pound man. So I got off of the drugs within the first 6 months I was there. I am now walking and swimming and have quality of my life back, and he saved my life.
Neuropathy and Pain Centers of Las Vegas. The future is now. Short-term treatments and long-term results.
Call today and get back to enjoying life.
All right, everybody, we're back, and thanks for sitting in with us in our last segment right here on Variety Talk Live in Las Vegas. And Dr. Odell, that was some tour of this office,
Thank you.
tour of your patients. And I mean, I'm astounded and impressed by everything I've heard. Everybody is thrilled with the fact that they're not experiencing the same amount of pain anymore. And I just can't wait to get that word out to our audience, to let everybody know where they can come if they're experiencing this type of pain. Now, speaking of experiencing that type of pain, I understand that there are other issues and other types of pain and pain management that you're dealing with. Particularly the veterans who've been out there who are actually wearing backpacks, who've had problems with that. Some of them complain of problems with their backs and their knees, those sort of things that we didn't really discuss. Tell us a little bit about that.
Well, I do standard interventional pain management. In fact, I'm board certified by the American Board of Pain Medicine, and I'm also a fellow of interventional pain management from the World Institute of Pain. And we do lots of other types of pain management, from epidurals, like the other pain doctors do. We don't use steroids, though. When the patient can come 3 times a week, we use the machine for its profound anti-inflammatory effect. We have a paper in the peer-reviewed literature in 2008 on the anti-inflammatory effects of middle frequency current over electronic signal treatment. It's kind of a nerdy paper, but it's got all these mechanisms, and I hope someday it becomes a seminal paper, because it really is an answer to steroids. The word just has to get out. Furthermore, we do a lot of the other standard pain interventions, like we use radio frequency. This is a radio frequency needle, and this is used for patients who have facet-mediated pain. That's the kind of pain in the back that comes from the posterior elements, and I don't have a spine model with me, but the posterior elements are those things that keep you from turning. In the neck, they're flat.
Oh,
and
yes.
you can only go this, you can go this far.
So many people suffer
From that. Most neck pain is, a lot of neck pain is facet mediated. And what we do is we go in there and we diagnose by blocking the nerves to the facets, and then we can burn the nerves with this device. Now, this is actually from an outfit in Canada called Diros, and I don't know if the camera can see it, but this is just a single needle. The old needles used to be just like this.
Oh, wow.
If I turn this, you'll notice that these 3 tines come out.
That is so
That gives
cool.
you a 1.3 centimeter burn. The larger the burn, the longer time it takes for the nerves to regenerate. Okay, that can be done in the neck, thoracic region, low back. We also, a lot of us my age and even a little younger are getting hip and knee pain. The 3 most common joints affected are the hips, the knees, and actually the MCP joint, metacarpophalangeal joint. And of course, the first two are things you have to walk on, and they do have total knee replacement, total hip replacements. Total replacements always hurt way more before and hurt much less afterwards. Total knee is another story. They hurt way more afterwards, and they're a hard recovery. We have some fine surgeons in town that do these, and across the country, of course. It's a very good operation. My dad was an elite athlete. Before he passed away, he had 4 total joints, and he lived, to be 91. Now, what we can do, though, in the hips and the knees, in lieu of having a total joint, we can actually go in and burn the nerves to the capsule of that joint using this device. My first 2 hip patients, I'll never forget. One guy was 91. He was a young 91. And then another lady with HIV, and some of the reason why they didn't want to do a total hip on her. So, because again, I usually tell patients to go ahead and have the total hips done. Both of these patients, I burned their capsular nerves, and it's a very, very interesting technically what you do. A lot of fun case, and we can do it right here in the office with local anesthetic. Both of them complained and bitched and moaned for 4 weeks. I thought, geez, did I do something wrong? 5th week, both of them were happy as clams, and the reason is because the nerves from the capsule here took a long time to die back to the spinal cord. So if you're burning a spinal cord nerve, it dies back right away. Anyway, it's just technical medical nerd stuff, but we have burned nerves in people with total hip and total knee replacements that have helped. Although not as well as people who have the virgin joint.
And when you say burning, that doesn't create more pain. Of course, it ultimately eliminates pain.
It eliminates the pain. All we do is burn the tiny, tiny nerve that carries the pain.
And so it's a non-painful procedure as you're doing it.
Putting the needle in can be painful, but then once we know we're in a safe place, because we don't want to be near a nerve. Remember, the burn is only right where that target is for safety. Because in the spinal cord, you have a big nerve here with the medial branch coming off here. We want to burn the medial branch, not this nerve, and that's built into the machine. But what we do is we very carefully make sure we're in a safe place. We burn the little tiny nerve, and it will regenerate in time. But patients will have anywhere with this larger lesion from 3 months to 2 years of pain relief. And for people who don't want to have the total joints, especially the knees, I'd love to do these all day because they're so safe. They're so easy. They're easy to do now because I've done so many of them. I think some other practitioners in town are doing them. I'm not sure, but it's really a great procedure, and the people need to know about it.
Well, I would have to say that first of all, you're a rarity to have an apparatus like that, for lack of better words. To be able to treat, and that is what separates you from all the other pain management physicians out there, to be able to treat something, because let's face it, hip, back, those types of pain that people complain about every day are just astronomical.
The numbers are, yeah.
Yeah, and most of them are treated how? By opioids or some sort of...
Now look, if somebody... We have a 15-year-old girl right now who has a very complex problem with her neck. Her neck is not being held by the ligaments. And she has herniation, and she has spinal headache symptoms. She has to lay flat. There's a specialist in New York that's going to reconstruct her neck. I have been escalating her opioids until she has the operation. I guess he was out of town in July. He's very, very specialist of a specialist. So she's getting opioids, which makes sense. We're doing it for a short time, for a specific reason, controlled, and I escalated her dose up properly. Her mom's managing it, nice girl. I mean, and that's what the opioids are for acute pain, but not for chronic pain. We also do fancier stuff like spinal cord stimulators. If everything we try doesn't work, that's where you pass an electrode into the spinal cord, and we do the trials here, and then we send the patients to a surgeon for the permanent implant if it's successful. We haven't had to do too many, frankly. One of the big indications is diabetic neuropathy, painful diabetic neuropathy, and almost everybody here that has neuropathy, the pain goes away. Sometimes the numbness is harder, but the pain goes away. So we don't have as many spinal cord stimulators as other practices, but we get a lot of people better quicker, and without having to resort to that. There's also a new product out called a peripheral nerve stimulator by Bioness. I've only done a few of them, but what it does is it targets a specific nerve in the body that's peripheral, and you can put that, you can literally implant that. I can do it. It's not a surgical procedure. It's subcutaneous using ultrasound, and you can identify the nerve. You put that in, and that will fire. And if it's a mixed motor nerve, it won't affect the motor function, the movement, which you don't want to do, but it can block the pain. There's other techniques, more advanced techniques of using stem cells and PRP. I have had done some of those cases. Most of those are cash because the government, for some reason, won't pay for them. Regenerative medicine is an emerging technology, and I actually talked to a patient who had IV stem cells, and his pulmonary fibrosis went away. Pulmonary fibrosis is almost a death sentence. He then had the same treatment for his legs for neuropathy. It didn't work. Asked me if I could do it. Well, I said I didn't know, but I went to Phoenix to a company that does stem cells, and the neurologist there explained to me his technique. He charges $6,000, but it takes him an hour and a half. He literally maps the the major nerves that go into the foot, and then every 2 or 3 inches puts local, and then follows with the stem cells, so they're spread along the nerve. And $6,000 is a lot of money, but I think that it's really important that patients know, at least if it's beyond their reach, if we can't help them, at least they know it's there in case something changes.
Absolutely.
So there's a whole wide variety of things that can be done that run the gamut of invasion. I also want to add that many patients come in with sports types injuries, sprains, strains, stuff like that. All we do is put the Synexus on them. They're fine in 9 treatments. No invasion, no nothing. The machine is a muscle relaxation. In fact, I had shingles several months ago, and I have still have a little bit, and I put it on my forehead. It's in what they call the V1 distribution, which is the 5th cranial nerve, the 1st division, which is here, 2nd division is here, 3rd division is here, and mine wasn't really bad, but it kind of knocked me out. I think we had to cancel our first taping, but I've been using the machine on that to get rid of it fairly quickly, because what this is neuropathic pain, where the virus gets into the cranial nerve nucleus, just like it can get into the nucleus of a dermatome. You see people with it going around their ribs, and this is diminishing its effects.
Wow.
I have to admit, I haven't been using machines as much as I should. I'm not a very good patient myself. Whatever.
An excellent doctor.
But in fact, I forgot to do it today.
That's what happens when you get accustomed to it.
Yeah.
So what's really everybody needs to know is that you treat many veterans, but you don't have to be a veteran to come here and receive any kind of treatment.
No.
But the veterans do need to know exactly how they can get directly to you, particularly those who are veterans with the VA and connected with them. I heard a little bit about this choice program. Can you quickly tell us how the veterans can just sign up right with you?
Yeah, there are several programs that the VA offers, and we're on both of them. We're also with TRICARE. The challenge right now is that they need a referral from the VA, and apparently the system is set up now that they need a referral from the specialist, the pain management specialist. And I do know one doctor working there. I have not reached out to them, but we're having a very difficult time getting them to refer you because they don't know about us. Certainly, they don't offer the neuropathy treatment. Although I'd be happy to have them go to RST Synexus and buy Synexus machines and train them. I'd be delighted to do that. They would help so many people. In the grand scheme of things, the way the government spends a lot of money, that's not a lot. So. They do need to have referrals. Where Dean Heller is running right now, and is helping the vets, and I have sent him a letter, which is I haven't heard from him yet, but one of my staff is getting his health. His VA specialist is coming here on August 8th, and we hope to get the senator himself here because 8% of people have neuropathy. I mean. That is a lot of votes, Senator Heller. Seriously, it's a lot of people out there in this town can be helped. They don't even know it.
Wow.
They don't even know it. One thing I want to add, you'll notice that Kenny Alex said his pain was a 2. It went from a 4 to a 2. You notice he didn't say the pain was all gone, but you notice how happy he was. Now, what's a 2? What's a 10? Everybody's different. They say that childbirth is a 10. Obviously, I've never had a child. They say that a kidney stone is a 10, but I've never had a kidney stone. I don't know what a 10 is, but everybody's different, so it's a very subjective thing. But the thing is this man was very happy, and we changed his life. That is really what it's all about.
Absolutely.
And that is worth more than all the money in the world.
Well said. Could not think of a better way to conclude this conversation. And again, as one who just came in to actually do a story, I am beyond impressed with what I've heard and experienced in this office. And it's just my honor to be able to come in and to meet you, Dr. O'Dell, and to share the story with all of our Variety Talk family and let everyone know the possibilities of ending pain.
Well, we really want to thank you for the opportunity. We really want to get the word out both for this office and for around the country for the Synexus device, because it's really been underutilized. And there's a lot of companies out there that claim what this machine does, but there's not even close. And that's really where the power of the device is.
Absolutely. So everyone, please look up Dr. O'Dell, Dr. Robert O'Dell, MD, and he's located right here in lovely Las Vegas. What's your number, Dr. O'Dell?
It's 8084 West Sahara, and the phone number is 702-257-PAIN, PAIN 7246. And our website is www.nvpainrelief.com.
And there you have it, everybody. Dr. O'Dell, thank you again.
Thank you very much.
Appreciate sitting in your lovely office. We'll talk about your trains next time. Everybody stay tuned. We'll be talking about opioid addiction and how Dr. O'Dell can help out with that as well. I am your host, Linda Lee. Thanks for joining us on Variety Talk live from Las Vegas, and we'll see you again next time. Take care. All right, everyone, we are back, and 1,000 apologies for that abrupt ending. We had a few technical difficulties. So for everyone out there with pain management, with pain, which I believe includes pretty much of all of us, make sure you check in with us again. This will be a 3-part series where we will not only speak about just pain in regards to neuropathy, but we will also speak about drug addiction, opioids, and how we can actually work with the patients, or how Dr. O'Dell works with his patients in regards to the non-pharmacological techniques and procedures that he has in regards to the patients that he treats. So again, just remember, this program also is dedicated to our veterans. That does not mean that everyone else here in the city of Las Vegas and surrounding areas cannot come and see Dr. O'Dell, and for that matter, from across the country, because I believe he already has people from across the country joining him. But make sure that you give him a call. And again, it's the Neuropathy and Pain Centers of America. The phone number is 702-257-7246. Just remember, it's 257-PAIN. Everyone, thank you again for joining us. We will replay that this entire segment so that you can catch the ending of what Dr. O'Dell had to say. It was very important. And we will have part 2 and part 3. All right, so I am your host, Lady Linda, and thank you again for sitting in with us this afternoon and checking out an alternative to pain. Everybody, make sure that you drive to stay alive this weekend, and we will see you next week. Take care.